So once we've decided that we would recommend surgery for you, there's a few things that we do. First of all, we're going to go over all the imaging with you, the x-rays and the MRI, show you what we see, show you what needs to be corrected, and then we'll talk to you about the surgical plan. If the surgery involves both myself and Dr. Hellman, then both of us will speak to you, talk to you about what our parts are, how they work together, why they're necessary. Also, very importantly, we go through the risks and benefits and alternatives to the surgical plan that we're offering you as well. That'll be done in the office with us directly. There's usually also follow-up visits with our PAs. Both of our PAs have been with us for many years and are extremely experienced in hip preservation. And so the visits with us are usually followed by visits with our PAs to go over more of the details, what to expect from a logistical standpoint, certain equipment that you may need to pick up. You also have to get preoperative clearance from a medical doctor before surgery just to ensure you're safe enough to have the surgery as well. So there's a number of moving parts that occur before surgery, but we do take the time to show you what it is the issue, what our plan is to fix it, and then get you set up for surgery in a expedited fashion. In terms of scheduling, this is a little bit more of a complex situation because 2 surgeons have to be present for the surgery. And so we have designated days, 1 or 2 days each month, where we do these cases together, Dr. Ellman and I.
When we schedule you for surgery, okay, assuming this is a combined what we call a hip arthroscopy, which is what I do, and Ganz osteotomy or periacetabular osteotomy, which is what Dr. Hugate does, you're going to get a bunch of information thrown at you in a very short period of time. Okay, we try to be as thorough as possible in trying to give you information in a organized fashion. So the first thing you'll get a packet of all of our surgical information. That packet has a ton of information in it, and it should answer most of your questions, truthfully, that most of our patients have. But it should walk you through the pre-op, the intra-op, and the post-operative care that you're going to get. The most important things that I want you to remember, okay, from a patient standpoint before your surgery, there's going to be a lot of stuff going through your head. Remember these 3 things. Number 1, get yourself some crutches, okay? We sell them at our DME store, okay? You can get them at a drugstore. I don't care where you get them. Just make sure you get yourself some crutches beforehand. Practice on those crutches, okay? It sounds weird, but going non-weight bearing after a surgery for a lot of our patients, some of them who are very young and have never had surgery before, we want you to be good on your crutches coming out. So it's important for you to practice your crutches. Sometimes it's important to set up a physical therapy visit before surgery to do a prehab type visit where you learn how to use crutches appropriately. That leads us into number 2. Call your therapist. Okay, we want you in therapy right away after the surgery. Within a week or 2 after your surgery, I want you in formal physical therapy. So call your therapist. It may be a good idea to get in one visit before the surgery, but we want you to at least schedule your first couple weeks of therapy 1 to 2 times a week for the first couple weeks. And then number 3 is medical clearance. We do like patients to get medically cleared by their primary care physicians before this. Try to get that done within 30 days of the surgery, okay? Send that clearance over to our office and you should be all done. Now from a phone call standpoint, you're gonna be getting a bunch of phone calls too. We don't want you to be overwhelmed. We also don't want you to be panicked. Within the week before your surgery, you'll really be getting 3 phone calls, okay? Number 1, from the CPM company. This is a motion machine that I like to use after the hip scope. We use it for a couple hours a day, okay? 4 to 6 hours a day for the first several weeks after the surgery. The reason we do that is to prevent what we call arthrofibrosis, fancy word for scar tissue. We want you to not have a stiff hip when this is all done. We're doing a lot of surgery on your hip. There's a chance for scar tissue to form. This machine helps prevent that. So that's why it's really important for you guys to stick with the instructions and use the CPM. So you'll get a call from the CPM company. We're fortunate enough that they will drop it off at your house. I do use a hip brace afterwards. This will protect you if you were to fall afterwards, and it'll protect you from doing ranges of motion that Dr. Hugate and I don't want you doing in the first 6 weeks of your surgery. The brace company, and we are now doing this at Panorama, will come to your house. They will call you within a couple days of your surgery and schedule whenever works for you to come to your house, drop off the brace, fit you for the brace, and teach you how to use it. Okay? And the third thing that you'll get a phone call about is the timing of surgery. Okay? This is all decided within a couple days of the surgery itself. So the hospital will call you and basically give you a time to show up for your surgery, which is usually a couple hours before the actual surgical time begins. So those are the 3 phone calls you'll get before surgery that you should be looking out for. If you don't hear from any one of those companies, call them. We'll give you their numbers. It's in the packet.